Welcome, friends, and thank you once again for listening to and looking at the Optimal Health Program today. A lot of great topics to talk about. I'll give you the overview here. Interesting comparison between mammography and ultrasound and thermography for breast tissue, breast evaluation. We'll cover that. Are eggs good or bad for cholesterol? All the old, outdated, ridiculous suggestions have been overturned, and we've known this for a long time, but this just is another study that describes that. We'll chat again about Epstein-Barr virus. You had a lot of questions about that the other day because it's a virus that can cause a variety of problems, not just fatigue. And some people are lifetime carriers for it and bounce it back and forth to other people. So you could be sick from Epstein-Barr and not have the full complement of antibodies show up. As I made the comparison to Lyme disease last show or the show before, we'll talk about that as well. For those of you doing the juice cleanse, for some people this may be a problem because doing just juice cleanses may disrupt your gut microbiome and wipe out certain good organisms that you would need there for breaking down your foods. And this may occur in the first couple of days. So we'll talk about a study on that. We'll talk about the benefits and drawbacks to cold plunges. You may not realize this, but some significant risks with cold plunge. And environmental factors that help to decrease your progression to aging. Interesting study. Strength training could also help older adults overcome insomnia. So a lot of interesting stuff in the news. If you'd like to call in to ask a question, 888-420-9272. 888-420-9272. Of course, we love to get your emails, your texts from all our Reddit, TikTok, Instagram, Facebook, Rumble followers and friends out there. So this is always a live program. So we want to be able to interact with you in a live fashion. So as opposed to doing something that's already pre-created, we want, feedback and information from you. The Garden City office is 516-794-0404. Website is drcalapai.com, CALAPAI.com. Thank you so much for all the emails reaching the site. After every program, we get a huge number of emails, and I'm very thankful for that. And we love to chat with patients, and myself and my staff are working diligently to be able to answer your questions as best we can. Although sometimes remember that without looking at your prior testing, whether it's an MRI or blood work, it's hard to define exactly what's occurring with you. That's why we typically might recommend that you bring in those things when you come into the office for the consultation. It just makes it easier for me to understand what's going on if I can look at what's trending in your blood work or your other tests. Okay, let's talk about a couple of things. One of them initially, mammography, ultrasound, thermography, MRI. These are all good tests. Some are better than others. There's some women who don't like the idea of having the mammography done because of compressing and radiating breast tissue. They believe is a problem, and I agree with that. There are studies where women whose family member had the BRCA gene or cancer gene, and they wanted to do the MRI, the mammography on those women more often than once a year, and more often than once every now and then. But they started to realize that may increase the risk of breast tissue changes and damage. So that was thrown out a few years back. Some comparison to mammography and ultrasound. Ultrasound has higher sensitivity and is more accurate in many women, up to the 50 or 60 year of age range. And it's still a very safe, simple test. This study published in the British Medical Journal talks about potentially that mammography might be better for women over 65 years of age. I would still recommend doing thermography because it picks up abnormalities in a different way, typically earlier than the calcification that can occur that mammography picks up. Heat presence in breast tissue where there may be a tumor, getting more blood vessels to grow to the area. So in a perfect world, I would do thermography, ultrasound, sonography, MRI, and potentially decrease the frequency of doing the mammography. If there's a reason to do it, I understand, but I think there are better tests out there. In doing side-by-side mammography and thermography, I remember reading a study, 10 years ago, that the thermography picked up abnormalities 10 years before mammography. So another interesting study about detection of breast cancer with thermography. So I think it's a great test. I think it should be done. It's safe, it's simple, it's easy. It may cost $175 to $250, depending upon where you go. There's no reason why you couldn't do that and do it yearly and get a little, graph and, watch year to year what your tissue's doing. So I think that makes a great deal of sense. Are eggs good or bad for cholesterol? Now, I'm going to comment with my opinion. Sometimes I do, sometimes I don't. For many years, cholesterol, of course, has been a concern for many people, more so for some than others. Yet there are people over the world that have high cholesterol and no plaque. So it's not the only cause of plaque, as we've been made to think. There are probably 50 things that contribute to plaque: infection, heavy metals, high LDL. The small LDL is the worst of that family of the LDL, subclasses. So the list goes on and on: high homocysteine, high fibrinogen, high C-reactive protein, etc. Vitamin deficiency, hormone deficiency and decline. So you can't just look at cholesterol and think you have the entire picture understood. When you look at a food that has cholesterol in it, that typically can't control your entire cholesterol. And we've proven this, and doctors that go all the way back talking about doing low-carb diets, you can burn right through that cholesterol to decrease it and keep it down with low-carb diet, exercise, as I recommend, correcting vitamins, minerals, hormones. So just because a food has cholesterol, it doesn't mean it's going to make you have high cholesterol. That's a superficial idea. It was back when they said that. And all the low-carb diets, and doctors like Atkins, rest his soul, and others that were talking about low-carb have helped to prove that wrong. And I have lots of patients that eat eggs, and they don't have issues with their cholesterol. So in 2015, dietary guidelines were removed, vilifying eggs for the cholesterol numbers. Then once again, another study in 2021 supported that. And they were tracking and have been tracking egg consumption over 48 years with some of these comments, and some of the better doctors and nutritionists were talking about abandoning this, and this has been done. It's been abandoned. So eggs are good for you. They have a lot of good nutrients in them. B12, vitamin A, choline, lutein. So keep the eggs in your diet. Of course, now eggs are more expensive for a variety of bizarre reasons, and I don't understand why these facilities are just burning down where you can get your eggs or chicken, or everything is supposed to be anti-beef and, climate change, cow gas. I mean, this stuff makes zero sense, but it's being pushed, I think, because they want to make fake meat and they want to make things that substitute for the natural, healthy foods that they have. Keep your eyes and ears open. Understand what's going on. I think having the best, healthy, safe foods that we've had for many, many years with great response is a lot safer than getting some lab-grown stuff. So, and understand who's behind it and watch to see what's going on there. Okay, phone lines are open, 888-420-9272. If you'd like to call in to ask a question, you could do so now.
So we just have a question on people asking on TikTok. They said, similarly to the egg problem back in the day, I also remember hearing for years that salt was bad for blood pressure and to prevent heart disease. But now some studies are saying that it's not harmful, and, we should be having more, and having too little salt, it might be too unhealthy. So is that another one of those?
So we have to be careful with making a blanket statement for everyone. There's no blanket statement for everyone per se. But some people, and based upon literature and research, the average person has 6,000 to 7,000, sometimes more, milligrams of sodium per day, which is a ton. You really don't need more than 1,000, 1,200. There are better sources of salt instead of, table salt. There's iodized salt. There's Himalayan salt. There's sea salt, which I think are safer and better for you. But, if a person's having a ton of salt, you don't want to add to that. You want to keep it into a tighter range. Some people do have high blood pressure because too much sodium in their diet and not enough magnesium, potassium. So if we bring the sodium down, raise up magnesium, potassium, you may have a better blood pressure because the magnesium, potassium help to relax the smooth muscle around the blood vessel wall, as this little diagram shows here. I don't know if too many people can see that, but the dark colored are the smooth muscles around the blood vessel. So in a perfect world, you want to get your blood done to look at your vitamins, minerals, hormones, etc., things we talk about all the time, and make sure you're in perfect range. I don't like to make blanket statements about different recommendations for food or for sodium or for this or that. I like to make it specific to each person. Every now and then I'll make a blanket statement about eggs. I think eggs are great for you, and people eat eggs, and I can show that they, create no problem for them. So I think eggs are fine. But you have to learn about your body to understand what you need to do to influence your best outcome.
And then we have someone on Instagram just saying that, for decades the government pushed these, studies that were based on, where'd it go? Basically saying that, the studies were clearly based on small populations and flawed data regarding the eggs. And they,
So, yeah, it's true. I was looking at some literature the other day talking about that a lot of the studies that are done are made to change the thought process of people to think that a medication is the thing they have to go towards to help their problem. Over many years in my training and after getting out of medical school in 1986, internship, residency, et cetera, there was a step care approach to hypertension, which is what we were taught. And first, the mechanism was to look at the person's lifestyle, change their diet, cut back on or get rid of smoking and cigarettes, get people to exercise. So these were steps before going to medications. But that sometimes, and has been, for a large part, pushed to the side. Now, again, if a person comes in, their blood pressure through the roof, you want to put them on medication, as I might do, to get their pressure down to keep them in the safe zone. But I wouldn't leave it at that. I would cut the carbs down so they can bring down their weight, cholesterol, triglycerides, get them to do some exercise so you're burning sugar and fat. You're dilating the blood vessels and getting them used to dilating from the exercise, which obviously would bring your pressure down, correct vitamins, minerals, and hormones. So there's an entire comprehensive approach that I talk about as opposed to just using a medication. And that if that medication doesn't work any longer, use another medication and another medication. Another case in point is that a lot of doctors use diuretics to lower blood pressure, and they do work. A person with a high blood pressure that's got swelling of the ankles, you could use a diuretic to help to get rid of that fluid, bring the blood pressure down, but a lot of diuretics wipe out magnesium, potassium, and if those minerals are low to begin with, you may be making the problem worse. So it may help you in the short term, but then if you depleted some of those minerals, the magnesium, potassium, you're making the problem worse, then another medication is brought on and another. So it's got to be a more comprehensive approach where we look at all the vitamins, minerals, hormones, put the entire picture together. And yeah, if we need to use a medication for a short period of time, we can do that. I just don't necessarily think that you have to use them all the time and then pile them up over and over again.
We have a Rumbler asking, can you blow the lid on artificial sweeteners?
Absolutely. So just like RFK Jr. has so wonderfully done, and we did a program a couple of weeks ago, and I don't know where my studies are on that because they're somewhere on my messy desk. They say that a messy desk is a sign of a brilliant mind. I'd like to think that that's true. But the artificial sweeteners to your body seem like a huge influx in sugar, and they can make you spike insulin release, which is not good for your body. So if your body sees that they're coming in, besides other chemical side effects from these things, if you're spiking your insulin and now you're dumping insulin, knocking your sugar down, that may make you more hungry, may make you feel hypoglycemic, may make you want to eat more. That may be stuffing sugars inside and along the blood vessel, and lining your blood vessels in your body. So there's probably more damage to that than not. So I tell people you try to use agave or some of the more natural things that are sweeteners where you don't get that effect. I also don't want people to maintain a sweet tooth where they're constantly looking for something sugary, because that's a detriment down the road because you'll be eating more than you should eat. and you could be spiking your sugar and knocking your sugar down, craving more. So it's not great for your system for sure.
Okay, and then we have one from Instagram asking, what causes uncontrolled blood pressure highs and lows? I know someone who has this issue with fluid retention and migraines.
So uncontrolled blood pressure could be issues with your kidneys, could be issues with your heart or your brain. There are people that have head injuries, and it doesn't have to be an overwhelming, horrible head injury that disrupts the mechanism that helps to control your blood pressure. The feedback, and there are many types of systems that are feedback mechanisms to your brain, of course, because your brain is like the computer that controls how your body works. And that connection between your brain and your organs can affect how your pressure goes up and down. Also, sodium intake in the diet, as we've mentioned, hormone level decline as well, low levels of magnesium, potassium. So when I see a person that has hypertension, I'm looking at all of the things that correlate with that. Overweight, sometimes a weak heart will do that because the heart is struggling to push the blood out of the heart into your aorta and the rest of your blood vessels. And in doing that, that back pressure on the heart can cause hypertensive heart disease. But if we're able to bring down the weight within a variety of different mechanisms, whether we might use a diuretic to get rid of some of the fluid, but a potassium-sparing diuretic that's not going to wipe out the potassium, and we get people to do a little bit of walking, a little bit of exercise, make it easier for their body to open up the blood vessels every time they do activity, correct vitamins, minerals, and hormones, that's the best way to go about it. But there may be a dozen different reasons why a person's got fluctuations in their blood pressure.
All right, we got a Redditor that I'm going to botch a lot of these words, but we're going to try our best.
Go for it.
Frankie. All right. My mother had hypothyroid condition for almost 20 years and was on levothyroxine. Thank you. Suddenly, near 2019, her condition switched to hyperthyroid, and now the doctors have put her on propylthyrosol.
Propylthyrosol.
Thank you, sir.
Yeah, so if her thyroid wasn't working, well, then for some weird reason it started to overreact or overcompensate, and the thyroid's high, they're using the propylthyrosol to kind of shut down the overproduction of the thyroid hormone.
Yeah, there's some more. So they told us that soon she will have to either decide if she wants to take radioactive iodine or thyroid surgery. Neither option sounds good to us, so I'm trying to explore possibility of stem cell treatment to avoid surgery. If any of you have any suggestions for the type of stem cell and best place to go. Oh, so they're kind of asking.
So the concern is her thyroid irreparably damaged so that it's constantly making too much hormone, and that can cause problems with your heart and the rest of your body. Using the medication may be an option. And in many cases, when people use the radioactive iodine, or they'll remove part of the thyroid that's just going crazy, will allow that thyroid to balance out. Sometimes people need to take thyroid for that, if they're not making enough of the T3, T4 anymore because of the medication or because of the surgery. And some people do very well with that. Stem cell therapy, your best source is from your own body. And I've done it for the better part of 12 to 15 years, we think now. So using your own stem cells help to shut down the inflammatory cascade, help to make brand new cells in tissues where there's damage or degeneration. So there's always a place for stem cell therapy for people that have medical concerns, degeneration, inflammation, or people that have no medical problems at all. They just want to get their organs to function better and younger. I just need to get a better picture of exactly what's going on with her by looking at her blood tests, examining her, to get a full picture as to what's happening.
We'll see if they respond.
Yeah, as well, stem cell therapy is extremely expensive outside of the country, Mexico, Panama, Costa Rica, and Europe, and a variety of other places. So stem cell therapy cost is the least in my office because I've made that so when I first started doing this, years ago.
And then we're going back to mammographies. I've heard that 3D mammographies are more accurate than the 2D ones. Is there a big difference?
Well, it's going to be a little bit more accurate. All the machines that come about, after years and years of, progress and learning and tweaking and fixing. So, the old MRIs were not as good as the new MRIs that are 4T now. The bigger magnets, they're much more accurate. Still, mammography is using radiation. The 3T is more accurate than the older ones, than the 2 or the prior. But It depends upon whether or not you want to do a test like that. I think thermography is a great option. I think sonogram and MRI are great options, and they're probably better than the mammography. And then there was another test we spoke about the other day where it's a new type of MRI, and it talks about being able to see from multiple angles. And I got to figure out where I have this. It's on my desk here somewhere, talking about a new, is it a PT something MRI that can show you more depth and more potential for spread. But I'll grab that article as soon as I can figure out where I put that. And that's a more accurate way to do an MRI, which would be the best test by far.
We have another one from Instagram. I've noticed a rise in younger people getting diagnosed with MS, colitis, and fibromyalgia. Could this be linked to anything?
So we
And
don't
then they
usually
said, by
link,
younger, I mean 25 to 30.
Yeah, we don't usually link or try to find a cause that happens in all those things. We know that MS is correlated with heavy metal exposure. That's been documented. Same thing with Parkinson's, Alzheimer's, liver, kidney, heart failure. A lot of organ damage occurs from heavy metal exposure, and everybody, kids as well, will be exposed to some of these things: aluminum in pots and pans, antiperspirant, aluminum foil, among many other things, arsenic in chicken, shrimp, rice, apples, California wine, mercury in fillings of your teeth, mercury in fish, so lead, mercury, and cadmium, lipstick and makeup. It goes on and on. And doing testing for heavy metals for many years, my entire career, we see more people that are younger have exposure just based upon what they're eating, doing, and putting, next to their body. We spoke about the water bottles, the plastic water bottles. If they're out in the sun, those water bottles can leach metals into the water. If your home water system doesn't have a triple reverse osmosis filtration on the water coming into your home, then you'll have some exposure there. So the exposures are vast. There are also comments about spraying in the atmosphere and cloud spraying and seeding that may have a lot of aluminum in it. And I think 4 or 8 states now are banning spraying the skies with this crap. So, we thought this was a goofy thing years ago, and, oh yeah, conspiracy theory, blah, blah, blah. Funny how a lot of these conspiracy theories have become true, by the way. And then if the governors of those states had to pass legislation to do that, trust me, it's a real thing. So, yeah, I think heavy metals are a major cause for increases in all the neurologic disorders, also anxiety. Fibromyalgia is another common mechanism, but I think fibromyalgia started out as a term where doctors couldn't figure out why people had multiple areas of aches and pains, and, pressing upon the muscles would elicit pain, where nerve roots crisscross. So fibro can be coming from a variety of things. In some people, it's Lyme disease, absolutely. Other people, it's Epstein-Barr. For others, yet, it may be, mineral deficiency, hormone deficiency, heavy metal exposure. So there's more of this over time as you start to understand what's going on and looking for the causes of these things. What was the other? There was one more.
Fibromyalgia, colitis.
Oh, colitis. So with all our colitis patients, and we will interview a gentleman within the next couple of weeks on his miraculous result from colitis, I think it has a great deal more to do lately with the GMO component of the foods. I can document that because a lot of my patients that are eating certain foods will have big issues with it, but when they go on vacation to Europe and they eat the bread or the pasta, etc., they have no stomach-related issues. So with all those patients that have stomach issues, we'll get them to test for food allergy, take those foods out of the diet, they improve. Get rid of the grains, because I think the majority of them are GMO, they improve. Correct vitamins, minerals, and hormones, they improve. And of course, we do stem cells for that. And putting brand new cells into your bloodstream to go where you have damage, degeneration, or inflammation in any of your tissues will allow stem cells to set up shop and become new cells and shut down that inflammatory cascade. So yeah, we obviously have done that because we've seen so many people with gut-related issues. Those are increasing over the past probably 10 years. So yeah, there's always reasons why, and that's part of my job to look for those reasons and those causes.
We got a fun one. Why do some vaccines contain heavy metals, doctor?
So for many, many years, and this wasn't really true going back to the 60s, vaccines they've put aluminum and mercury in vaccines. The mercury is called thimerosal. Also, years ago, thimerosal was even used in eye drops by Bausch and Lomb, but then people were starting to have issues with that, and they believed that correlated with cataracts for some people, so they took the thimerosal out of the eye drops. So there are studies that say that there's a certain amount of aluminum or mercury or some of these metals that are okay for people to be exposed to. And if you think about this, when vaccines are made, the manufacturers want to have a long shelf life so they can sell more of it. It can sit on the shelves in pharmacies for a while longer to be able to be sold and utilized. There's always been an issue with the thimerosal, the mercury, and the aluminum in the vaccines, among other things that are in there now. And if you want to have your head blow off, you can look at vaccine ingredients. You'll be able to see that there are so many different things in the vaccines that you don't want to have in your body. I think that's why those adjuvants and those things are added to the vaccines. Another curious comment, I saw this the other day on social media, and someone had mentioned, how long does it take to make, 330 million vaccines? It doesn't take a week or a month to make a flu shot for, the entire country. It takes a very long time. It would have to. 330 million little vials. So when this viral phenomenon came in 2020 and vaccines were being made, how in such a short period of time did they make 6.5 billion vaccine injectables? Ask yourself that question. How many years would it take to make that many injectables to treat billions of people? And the person talking about this said, well, if you had 10 facilities, 100 facilities making it, 1,000 facilities, it would still take many years. So is this something that was planned and created many years back? This is what some of the research has discussed. In 2015, the Journal of Nature and Science, and these articles you could go and look and read, said that we shouldn't be messing around with coronaviruses because of the possible transmission to humans. I'll leave it at that. But go online and look at this. Look at the research. Look at truth and fact. Very curious.
I'll go to sleep nice tonight. All right. On the topic of heavy metals, my Nana always said that fish contains a ton of heavy metals and was always cautious about the fish she ate and the amount of it.
Yeah.
Is this
Nana's
serious?
smart. All the Nanas had great ideas back in the day. I remember my grandmother saying that you shouldn't have too much sugar because it caused worms in your stomach, whether that was true or not. I don't know, but it scared me away from sugar. And yeah, there's always been a comment about the mercury in fish. So the warning has been not to have, fish that are caught right offshore, and to opt towards cold water, deep sea fish. Maybe the wild Alaskan salmon is probably the safest out of all because it's in wild environment and waters, better waters. But you could go online and look at, testing occurs every month or a couple of months where they look to see how much mercury is found in some of the fish, from different populations in different areas. And then there may come a warning that says, oh, don't eat tuna because we're seeing that there's more of the mercury in the tuna caught lately. So you have to keep your eyes and ears open for that. And look, I tell people every day, go online and research, look, because there are exposures that you wouldn't realize.
And then we got an additional Nana fact. She said she also taught me not to stand in front of the microwave. Is that another one? I've always avoided it.
Yeah, and
too.
they told us not to stand in front of so close to the TV. And then when computer screens popped up, don't get your face right up in front of the computer screen. A lot of people have issues with being very close to the computer screen. Some people put on a little bit of a filter. So, yeah, I think there's certainly something to it. I think these things could probably have effects on some people more so than others.
I'll say something with the microwave. When I was a child and my parents were having our kitchen redone, our Wi-Fi router was above or near our microwave. And we figured out, every time we turn on the microwave, everyone loses Wi-Fi. So just know that those little beams aren't staying within its little box.
Yeah. Look, there have always been questions about cell phones and how they may affect you. There have always been questions about, electric currents that exist through the house. There's some people that will call companies to come and see what the electric exposure is in and around the electricity coming into your house, different parts of your house. I mean, I think it's always makes sense to learn a little bit more and to test and see what's going on. I mean,
there are, my a builder friend of my family's. They said, you have to go check out. To my parents, said, you got to see this house before it's sold. This thing is incredible. And it's some, billionaire's house. And when they walked in, they said, what do you notice about the bedroom? And the bedroom, Doc, had zero electricity. The walls in the bedroom were like 1.5 feet thick, and it blocked all the wireless transmissions because this guy did not want these signals touching him when he slept. I was oh, that makes sense for the billionaires out there.
They probably know something that we don't know as yet, but, the body is a huge electrical and chemical plant. So your body will respond to different things that are presented to it. So better to be as safe as you possibly can. Why not?
And I'm sorry to our Rumble audience. Rumble is down right now, which is, this happens once in a while because it's our free speech platform, and it does get attacked from time to time. We have a question from Reddit, though. I'm 50 and I've skipped a few years of the mammograms because I've never had any issues. If I don't have any symptoms or a family history, is it really that important to be getting screened?
I would probably go for thermography. You should definitely have a doctor examine you. I can't tell you how many cases I've seen of patients that had little nodules in their breast and had abnormalities that ended up being breast cancer that didn't feel them themselves, and some people don't examine themselves, I would look online for a good self-exam description of what you should do and see your doctor, OBGYN, who's got a lot of experience in examining breast tissue, and do that. I would go for thermography. Any question from the doctor, get a sonogram or an MRI. Those are great tests, and there's no risk with those tests. So it makes sense. Just like with patients that, women that as they get older, you want to do a sonogram of the pelvis and the abdomen to look at their organs and look at the ovaries. God forbid there's something problematic with the ovary. You may not feel any symptoms, and unfortunately, there have been patients that I've known and seen. Their doctors really didn't pick up on abdominal complaints, and woman ended up having ovarian cancer. By the time that they diagnosed it, it was too late. So there are certain tests that are important to do that can actually save your life, that are without risk, side effect, or concern.
And then we got one from TikTok saying, I recently tested my home's water and found some traces of arsenic. How does arsenic get into drinking water, and what are the long-term effects of this?
Well, all the metals come from a variety of different places. I don't know if a person's got well water, and it could be certainly coming from contaminants, in the aquifers and such, but it may be coming from a variety of different places and getting into that water that comes down from, the sources of water upstate. It's hard to say, and we know that, lead can come from lead pipes, but there are a lot of chemicals that just leach into the environment, and I think maybe that's where they're coming from. But you want to get rid of all the heavy metals in your water, so you want to get a triple reverse osmosis purification system to be able to grab those things and take them out.
Yeah, and then we got a follow-up. Do you know of any water filters that you recommend for those staying in apartments and are limited?
I know there are a couple of companies that make these things.
Yeah.
And Culligan is one. Aquapure is another.
If you don't have the ability to get to the main water source, if you're in an apartment, you can get individual ones.
You can put them
tap.
under the sink.
Right.
Yeah, I think they're good, but you have to get the ones that are triple reverse osmosis filtration, which would be a couple of different canisters. And some people might put them, a shower head that may offer some protection, although it's not going to be as good as the triple reverse osmosis or the ones coming into the house or the apartment. But do whatever you can do. Only cook with water that's been, through the reverse osmosis under your sink if you have the apartment.
I have a question personally because you had mentioned lead. Is lead like I understand there's plenty of research and we look back at like the Romans, like, oh, why did they go so crazy? Oh, because they had all lead pipes. Are there still some water canals that are going through lead pipes still? Like,
it's hard
crazy
to say. I don't know about the commercial or everything coming down from upstate.
Right.
But older buildings have lead pipes. So. And it doesn't have to be that the water is the only mechanism or the pipes are the mechanism of lead exposure. It could be coming from different sources. So that's why you want to test the person to see what their body's exposed to. In some cases, we may not find the perfect answer as to why they have a lot of lead or mercury or cadmium. I mean, lead, mercury, and cadmium are in lipstick and makeup, of course. So that may be an exposure for one person or a group of people. Others, you may not understand why. Cesium and gadolinium are used in medical dyes for injections for CAT scans and MRIs. We know that. Thallium from thallium stress tests. Platinum from cisplatin, a chemo drug. But in some cases, we can't say why a person has 10 different metals on board. It's just the accumulation through different circumstances throughout their life. But the key point is if you find them in blood and more accurately urine, you got to get them out of your body, remove them, because they don't do anything healthy for you. They just cause damage.
And then we just have a comment here. Someone saying that they buy bottles of water to avoid the tap water. You could respond to that.
Well, it has to be glass.
Yeah.
Because glass is safe and inert. Plastics, as we've mentioned before, have bisphenol A, nalgene, some of these chemicals that could damage your hormones, damage fertility. That's been known for a long time. You could look this up, bisphenol A, bisphenol-A. There are triangles on the bottom of the plastic water bottles with a little arrow. It's like 3 different arrows that make a triangle, 1, 4, and 7. And it's supposed to be that if it has a 1, you can use it once. I wouldn't even use it once. 4s and 7s may be much higher risk for medical issues, but I would only use glass bottles for water. And get your heavy metal blood and urine tested.
Okay, we have this one from Reddit saying, I've read that brewing tea can help remove heavy metals like lead and cadmium from drinking water. How effective is this method?
Zero effective. There's no benefit from that. So chlorella, spirulina, a variety of different things have been commented upon that are supposed to detox you. Yet there's no science as to what you're detoxing or what's actually happening. Brewing tea does not remove heavy metals. There's never been a comment or a study that says, here's the tea. We had 100 people or 1,000 people or 10 people that drank tea, and when we tested their body for metals, we saw that there were less. It's never occurred. When we talk about doing this, everything that I describe has to be based upon a rational scientific mechanism. So to give you the comparison, on the one side, you could say tea, chlorella, spirulina, different oral vitamins, etc., saunas, whatever you want, foot baths, foot pads, which I think are just fraud. And we'll talk about some of that occurring in, I don't want to call them doctors because a lot of them aren't doctors, offices and some offices, etc. But I've seen people that have done all of those things and said, yeah, I'm detoxed. I did this, I did that, blah, 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 blah. And I said, well, then you won't mind me, just asking you for a sample of urine to look at 21 metals, and if what you've done is work, they'd be gone. And in doing that, every single person I've seen, and these are people that are relatively intelligent otherwise, has heavy metals come out in the urine. And then we'll do an IV that has been documented and proven to remove the metals, bind to them, pull them in the urine, then pull them into the urine. Then you do a 12 to 24-hour urine after the IV to see what comes out, and more come out. So I know that those things do not work at all because we're doing proven testing that's been around for decades to show that the metals are still there. I wouldn't mind if you said I took a supplement or I took this or that and I tested the metals before and tested afterwards, and we could reproducibly and reliably see that there's less, but that just does not exist. So these are comments made by non-scientific, non-doctor people telling you to do something because you have this desire to do something, and they're giving you this comment, and nowhere in their recommendation is the proof to show you that what they've done has worked. So that's not science or nonsense, which is kind of like not science and nonsense. So my little put those words together. There are people who are going for all sorts of different things. And we have one patient that contacted me through the website and said they went out to a place. They were offering intravenous vitamin therapy. They were offering cold therapy, offering a variety of different things and foot baths. And I said, what doctor was this? And the person had commented that it wasn't a doctor, it was a nutritionist, it was, wellness person. I said, well, how are they doing vitamin IVs? Because they clearly don't know how to put an IV together, because only a doctor like myself, who's taken the training through a variety of organizations over many years, knows that there's a concept of osmolality. So the concentrate of your blood is roughly 300 milliosmoles per liter. That's a concentrate. If you look at water, of course, there's nothing in water. You look at your blood, it's got a lot of stuff floating in it. You look at Chinese hot and sour soup, it's got more stuff floating in it. So that's more concentrated, just for the sake of discussion. So if someone who's not a doctor, or someone who is putting stuff together in an IV to give to you has no concept of that, and they don't, because they wouldn't, they're putting together a medical treatment without any knowledge of you, because they're not doing blood testing, without any knowledge of how to make a safe IV. They're doing something that's, quote, invasive, because they're sticking the needle in to do the IV. And you may end up having a big problem from doing something that's not created and followed by an actual doctor, by a physician. Big risk. Some people that do the cold therapy, cold plunges, etc., if you were to have a scenario of what are called cold agglutinins, where your body creates antibodies, when the temperature drops like that, you could be damaging your own blood cells and causing clotting and clumping of your cells because of exposures to extreme temperatures. But those people don't know that because they're not doctors. So there are people out there doing things that they should never do, because for some people it would be very dangerous. When you're putting your feet in a bath and you're supposedly detoxing your body, I would ask people, what are you detoxing? Well, what are you taking out of your body? Where's the proof that says putting your foot in this bath, something in the liquid gets into your body, grabs something and pulls it out? Show me some kind of proof. And then test the liquid afterwards to see what's in it that came out of your body. There's none of that. So I don't believe in those things at all. And I think, again, these are more gimmicky and more dangerous than they are safe for you. Learn about your body first. Everything we need to learn we can do within that initial consult, within the great blood work, with the urine test for metals, etc. Then you put together a recommendation that is proven, that is safe, and will create result. You can't just wing it because some places are saying, this is what we do, and, blah, 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 blah. And they give you this, multiple person workup without looking at all the blood work. And then you're paying X amount of money to be on a program or a plan. It's wrong.
Yeah, we just had people commenting saying, I'm starting to question how healthy some of these alternatives are. Quote, alternatives. Then we have another comment says, so I found this interesting. It might be more of a comment, but I recently purchased an air fryer. Super excited to be able to enjoy some fried foods in a healthier way. But my wife noticed a ginormous warning label which stated that the product may contain chemicals known to cause cancer, birth defects, and other reproductive harm. Needless to say, as we are trying to conceive, I threw out my air fryer.
Makes all the sense in the world. So there is my perfect explanation of a smart person. Let the buyer beware. Look, learn, read, understand what you're buying, and that's really smart to do that. Are there some of those devices that may be safer? Yeah, it depends upon what they have as the coating. But if you see that on your air fryer, I would bring it back to facility and get your money back.
What, I don't understand. Are they made of plastic?
Well, there are linings of the material that you put the food into that may be exposing you to chemicals that you don't want to be exposed to.
How do they even sell these things?
Because it's the idea of I can have fried stuff without the oil. And yeah, there are people who like chicken wings, and now and then I may get a craving for a chicken wing, but I'd rather make it and do it, in my own circumstance as opposed to, not knowing where it's coming from or how they're preparing it. But yeah, people like the idea of getting the fried food without the oil and such because I think it's healthier, and it would be. But if you're exposed to these chemicals and such, it's not. It's a risk. It's smart. Smart to be curious. It's smart to be aware. If there's one thing that I want all my listeners and my patients to be is curious and question and look and learn and read. That's really important. Very smart.
Yeah, and this question's a bit more of a overall picture, kind of almost a politician question, but I'll read it anyway. I've heard about the Flint water crisis and its long-term health effects due to lead exposure. What measures can a community take to prevent such heavy metal contamination in their water supply?
Well, it's not as though the community can change that. It depends upon where that water is coming from. So they're going to have to rely on, pure bottled water. You would need to have some pretty significant water treatment facilities to be able to decrease the exposure to that. Years ago, a friend of mine who thought he knew everything about the stock market kept talking about a company that made these big devices that would run water through it and just pull all the impurities out. And they were going to put these all over third world countries. Of course, the idea was brilliant. I don't know if that company ever took off because I never took advice from that person because, he thought he knew everything and he didn't. But the idea of bringing devices to places like that to purify the water is critically important. It's super, super important. Needed in lots of different places within this country, much less should we be making these things for other countries throughout the world? Given the technology, get it done, but, do it here. There are people in here who need this help and this care and need to have that, the water purification done. And, it angers me that that's been a problem for a long time. I'm not going to get too political about it.
And we got another one that just says, I've learned a long time ago that nutritionists are very far and in between to get a real one. So
to be fair, and again, I owe my ideas to my audience and my friends and people here. Different people have different background and training. Some people have a very limited recommendation. Some people go by the 4 basic food groups, and some people are a little bit different. Some people are more progressive. It may be difficult to find someone who has, in coordination with a physician, to do your blood test, the right blood test, like the things I talk about doing, that can give you the best information as to what you eat and what you should take. My perfect discussion about this is you've got to get the blood test done for vitamins, minerals, hormones, absorption, digestion, gut microbiome, stool test. You've got to look at these things. Part of our blood test will be a little screening for food allergy, just to see if you have antibodies to some of the foods you're eating. And if you do, we'll take those foods out. But if you have a few antibodies to things, that may be because a lot of antibodies that you have for allergy are not necessarily near the needle where your blood's being drawn. And when one tube is for vitamins, one for chemistry, one for hormones, etc., one tube for metals, and one tube for allergy, it's 3 seconds of blood that fills that tube. So you don't have to have every antibody rush to that needle to show up when you're looking for them. So we do the blood as a screening. That's all it's meant to be. And then we do secondary skin testing. Skin testing is more accurate. It's done up in your upper forearm, and rather your upper arm. And we use a tiny little needle to put the liquid allergen into your skin. And in 15, 20 minutes, a half hour, we watch to see if that creates a reaction. If it does, take that food out. So that's an important part of creating a nutritional realm. And looking at your vitamins in your blood test, if you're deficient, then we'll put together vitamins and foods for you based on that. And then over the course of a month, avoiding the bad or the allergic foods, getting nutrients on board, that's the perfect way to have great nutritional status. But it's proven by that repeat blood test. It's proven by, you say, you taking these foods out and wow, you're changing, your symptoms are going away. This is far more than someone who's just trying to figure out, what you should or shouldn't eat without that information. So other people who are doing dietary recommendations that don't have your vitamin, mineral, hormone levels, that don't have your whole picture in front of them, that don't have allergy testing in front of them, you're not getting a full picture. Not to make anybody mad, but
no one's voiced their anger yet, Doctor. But I do have a good one that you'll enjoy this question.
Okay.
This is from back with the water filtration. Is it worth it to add a pH device after the water is filtered? They didn't listen to last week's episode.
The question is, do you want to change the pH of something or your water before you bring it into your body? I would say no. And I've been talking about this for a long time. Your pH balance in your blood is exquisitely controlled by your lungs and your kidneys. And only a doctor who went to medical school, who took physiology, and there may be other people with PhDs, who've gone through the training and look at lung and kidney physiology and pH, acid-base balance. You cannot take something alkaline, diet or food or otherwise, and make your body alkaline for a second, a minute, an hour, a day. It's not possible, because you have this exquisite balance in your body that if you take an alkaline, your body holds on to acid, doesn't let it go, to keep your pH at 7.4. If you're taking too much acid, like acetic acid, vinegar, is acid, then your body will pee out some of the extra acid to keep your pH at 7.4. Only in circumstances where your body is horribly affected, diabetic ketoacidosis, respiratory alkalosis, really life-threatening disorders, is that distorted. So you can never make your body alkaline. You can never make your body acidic, because the mechanism of millisecond to millisecond controls that pH. So your body is in that perfect zone. Also, and I learned this at a Cancer Treatment Centers of America conference many years ago, where I had the most incredible opportunity to meet Linus Pauling, who was one of the greatest brains of all humanity. 2 unshared Nobel Prizes, genius beyond genius. I don't know what his IQ was. It had to be in the stratosphere. So at his conference, we listened to him talk about a variety of things, and we were just completely in awe as to how well he was presenting everything. Didn't miss a step. And we were talking about how cancer uses glucose to grow for energy, like every cell. But when a cell mutates and becomes a cancerous cell, it needs more glucose, sucks it up faster to grow faster. That's really the mechanism. That research was initially Nobel Prize research for Dr. Otto Warburg in Germany back in the 1930s. Well known, the Warburg effect. So when sugar is metabolized, it breaks down to lactic acid. If that lactic acid in a cancer cell now is pushed outside of the cancer cell into an alkaline type environment, it can attract more blood vessels to feed the cancer more glucose. That's documented. If you have an acid environment around those cells, whether it's ascorbic acid, vitamin C, alpha-lipoic acid, etc., acid does not go towards that acid gradient, so that acid may help damage the cell from the inside. That's why if you look at vitamin C IVs on Google Scholar or any of the great search engines, and you plug in intravenous vitamin C therapy, Google Scholar has 1,600,000 studies on intravenous vitamin C therapy. A lot of them, many of them, maybe half of them, talk about vitamin C IVs helping to decrease the progression or stability of cancer cells. And you can look this up. I tell people to go look it up. Vitamin C has antiviral effect against COVID, against Epstein-Barr, shingles, rhinoenterovirus, all of that. But you don't want to be messing around with something you don't understand. And this is what a lot of people are doing. They're buying alkaline machines and spending thousands of dollars on this water because someone says it's a good thing for you. Wouldn't do it.
Okay, back to Instagram. Personal health failing, 1.5 years. Vaxxed, tested for everything. No results except for cobalt levels greater than 6. Had hip replacement, 30 years. Knee replacement, 2 years. Cobalt toxic thoughts.
So any of the metals in your body can create damage. They can affect your organs. They can affect your brain, any part of your body. So when people say they had everything tested, and I sit down with them, they haven't had everything tested. We may want to do a urine for heavy metals, looking at 21 metals, after an intravenous treatment to pull metals out to see what your body's holding on to. Some people have, and others haven't had vitamin testing done. They haven't had the gut evaluation done. So there's a lot of information we typically want to go over. Certainly, your hormones control how your cells work and how they age. Your vitamins are food for your cells. You could have low vitamin D and feel miserable. You could have low testosterone, IGF-1, which is the active component of growth hormone. There's a lot to look at. A 25-page blood test gives us an idea as to what's going on. So I have yet to see someone in doing this for 37 or 8 years, et cetera, bring in all the tests that we routinely do on every new patient. So that would be your first step. So I could take your history, examine you, do the testing, look at your prior testing, and see what's going on. Because it's not a simple thing that's allowing your body to progressively decline with your health. There have to be multiple things occurring there. And aging, to a great part, is hormone decline and neurotransmitter decline. Your neurotransmitters are not being made as much in your brain's not working right, your cells are shrinking in number, you're not making the same new cells you did when you were much younger, and your organs have the same sort of decline. It's worsened by outside influence of heavy metals, so it's a complex picture. It's not an on and off light switch, turning it on and off.
Looking for more. We're missing our Rumble. Our Rumble's still down. So
our Rumblers, we got to get that back up.
Sorry to the Rumblers.
888-420-9272 if you'd like to call in and ask a question. It seems that people love to text and email.
Oh, yeah.
Much more than call, but that's
no
fine.
Shortage of that.
I'm just used to 35 years on the radio, people calling and calling and calling. We used to have people call in, and around election time, oh, vote for Joe, vote for Joe. It was just, of course, there was a 7-second delay on radio, so those things never hit the air, but it was always funny to hear. Vote for Joe. He's great.
We got one from TikTok. Have you helped any patients that suffered grade 1 meniscus tears with stem cells?
Absolutely.
He said, I've read some different things on this, and I'm open to listening to what you have to say.
So we have lots of people who come in with knee injuries and tears of the cruciates, of the meniscus, of the medial and lateral collateral. We have hips and shoulders and wrists and elbows and every joint you can imagine, back and neck. We also, for educational purposes on the website, will show you people with strokes that have spectacular results with stem cells. MS, Alzheimer's, Parkinson's, COPD, diabetes reversal, lupus, rheumatoid, all of these things, just to show you how well your own cells can work on any of these issues. So, yes, your own stem cells from your body can be extracted in a minute and a half, spun for a half hour, separating red blood cells, plasma, stem. Stem come out, go into the joint to create repair. And some people repair quickly if they have a smaller amount of damage, and some people may take more time if they have a larger amount of damage. So stem cell therapy has been used for joint issues for decades and decades and decades. The first doctor to call it a stem cell was a Dr. Haeckel in Germany in the 1860s. And then after him, Dr. Boveri was the one that started using it and talking about it being applicable for all sorts of problems. And then the floodgates opened, and stem cells have been around worldwide for many, many decades. So in looking at all the research that I've seen and seeing thousands of patients and treating them, it's probably the greatest thing you could do for your body when you have wear and tear anywhere, joints, organs, brain, eyes. So the mechanism is very simple. These cells are there to do a job. Their only job, per se, is to go where there's damage and degeneration or inflammation and create and become brand new cells of that damaged tissue. That's called differentiation. So if you put it into a joint, you're creating more ligament, tendon, cartilage tissue. If you're putting into IV, it goes to your heart, lungs, liver, kidney, pancreas, gut, and you can see the response of patients that we've treated. Lung issues is IV with a nebulizer topically to your lungs. And then for brain and eye is a neurologic IV, and then a nasal droplet where we're putting it into the back of your nasal cavity, slowly dripping it, gets into your brain. So the literature is there. The evidence from my patients' results are there. So that's more significant than what most studies show about other things. And doctors will say, oh, we're not there, not enough research. I'm like, more than 4 million studies. How much more research do you need to show something that's been worldwide for all these years? They just don't want to give up either a surgical procedure or the medication route. So, absolutely, stem cells work great for joints. They're mesenchymal stem cells, which is what your joints are made of.
Unreal. All right, what else?
Yeah, so look at the website. I mean, the videos are there. drcalapai.com. We have a patient that, very nice guy, hardworking guy. I think he works for a car dealership. And, he's a rough and tumble guy. He's not, a sit around do nothing guy, and works out a lot, does jiu-jitsu for years. And jiu-jitsu will damage your joints. That's an absolute. I know it. I've seen it. I've done it. But he had some hip problems and came in. We did MRIs, got him all tested, set up, did stem cells on him. And probably 3 months after doing the stem, as we let him sort of just relax and let it work, he gradually started to train again, was doing better and better. By the third or fourth month, he went into competition, and he won his competition. He's got to be in his 50s or 60s, in the 50s probably, but he won a competition, because the stem repaired his hip. Can't get more obvious and specific than that. So I'm going to interview him on the program here too, so that people can see that.
And we're also going to have a good. When are we doing the Lyme's disease? That'll be.
I spoke with Dr. Burscano, who's a great, great, great guy, and I think he was the best Lyme doctor to date anywhere. He was so intelligent and so in depth in his protocols. I think he made 18 or 20 different 75-page protocols that other doctors could learn about and use to treat Lyme patients. And all the other Lyme specialty doctors now, arose out of his work and what he's done. Years ago, I had a fundraiser for Governor Pataki at my house. And Dr. Atkins came, had a really cool list of people there. I had it catered, really great restaurant catered it. And Governor Pataki had Lyme disease, and Dr. Burscano was there. So you could imagine myself, Dr. Atkins, Burscano, the governor. It was the greatest in my living room sitting around talking about all this stuff. And I have pictures. So Burscano was talking about, Lyme disease. And, the governor was completely, enthralled. So I've known him for a very long time. And I would call him and have questions with my patients, and he'd give me ideas and suggestions. And he's just great. Was thrilled to be able to come on the podcast. And in April, he's going to free up some time. So I have to call him towards the end of this month. But, very highly respected guy. I think he's terrific. He's helped more people, countrywide and worldwide than anybody else with Lyme disease.
That's going to be unreal.
Yeah.
It's crazy. A lot of weirdness with that one.
Well, the world's a crazy place, and people have already figured out that there are different approaches to different things. And we've understood this for many years. It's become more forefront lately for a variety of reasons, and people are looking for better alternatives for everything, for vitamin testing and recommendations, for hormone correction, and we talk about all of this, for treating different diseases and fibromyalgia and Lyme. And my comment is always learn everything about the causes that you can, causes plural, and then take that information, and that puts together your protocol. And do natural things along with whether you need medications, like for Lyme disease. Historically, the best antibiotic initially for Lyme is doxycycline, but it's meant to be 3 times a day, not twice a day, as you might use for skin pimples and stuff. But acidophilus, vitamin C IVs, peroxide IVs, there are a variety of great things that can be done to keep your body strong, because the antibiotic is not giving your body anything. It's there to kill. When it's gone, no kill. There, kill. Gone, no kill. Some people were given 2 weeks of antibiotic for Lyme when it first was thought that Lyme could be killed in 2 weeks, but I don't think Lyme was ever killed in 2 weeks by the antibiotics. So many people had recurrence. So that's why we talk about a combined protocol with what Dr. Burscano has taught me, and all the nutritional recommendations as well. So very, very important. We've also done STEM on Lyme patients and all the degenerative disease patients, and etc., because you want to have more brand new cells exist in all of your tissues and your organs to create a much greater healing, response.
Yeah. Especially on Long Island, it'd just be nice to be able to take my dog out and not come back with 30 ticks when I take her to the park.
You got to be careful. They say, and for a long time, people would wear white socks, tuck their white pants into their white socks, and white long sleeve shirts, and tuck that into their, just to be able to see if there's any ticks on them. But I don't know that you have to go crazy with that, depending upon where you live. But I have friends that we go out to Montauk all the time, and we go fishing off the beach. So either of the cars that I have that are four-wheel drive cars or trucks, get a pass, go right past the lighthouse, drive it on the dunes, go down a mile. My friend's got a truck with a camper on it, and we sit out and we can cook and eat, and it has a bathroom, and catch fish and this and that, have a wonderful time, invite friends out, have a great barbecue going. But the vegetation in Montauk is insane.
Crazy.
If you've ever driven down the road, and there's a long road, East Lake Drive, that goes along the airport, because I used to approach the beach by Shagwan Point. There's a shack there. You get your pass. And if you're driving down that road and you just look to the right and you stop your car and you look at the bushes, you can't see 1-2 feet into those bushes. They're so thick. So if you can imagine the gazillions of ticks in these bushes, I'm not just talking about the deer that live there, because there's tons of deer that live there. I'm not talking about being somewhere close to a deer and being exposed that way, or letting your dog run into the bushes. The vegetation is so thick, it's insane. So there's that much more exposure. So, yeah. Whenever my friends and I go out there, even though we're just on the beach, we always say, hey, take a look at my back, take a look at my leg. We check each other out to make sure that there's no exposure. But
yeah, we one of the first, my wife's family has a house there, her grandfather, and one of the first times I had went up there, we're just walking around the development, and she's like, it's funny, there's a nature trail here. I've been here my whole life, I never saw it. I'm like, great, let's go for a little hike. Yeah. Awesome. We walk, I'm telling you, maybe a quarter-mile path. We're not touching leaves, we're not touching trees.
Yeah.
We walked through. We're like, that was fun. All right, we got to go back. And then all of a sudden I said, no, hold on. Let me see your hand. I'm telling you, Doc, there were maybe 10 on her arm. And then I look at myself. We pick each other. We probably pick 20 off of each other.
Yeah, you have to. Yeah.
And then we get into a situation where we're not going back through that trail.
Yeah.
So I go on my phone to GPS. It took us like an hour walk around back through town because we couldn't do it. It was too
You don't want
dense.
that exposure. Yeah, it's crazy. So my friend and I will either take long walks and go down with our group, guys and girls, go fishing down the beach, and there between the lighthouse and the airport, there's a big pond, a lot of fish in there, crabs in there. And there's a shortcut way to get to that pond and that fishing area, which is gorgeous, by the way. You think you're in another world because nobody else is around. You don't see or hear anything. And you can see some animals and deer and whatever else. But my friend got an e-bike. I decided to buy an e-bike. So I bought a really cool camouflage e-bike, because I want to look like I'm cool. And it's got 2 batteries and 2 motors, wickedly fast, much faster than it needs to be because you can kill yourself, of course. But, we run it along the trail. And the trail's got to be 12 feet wide. And you're not really touching anything like you say, unless you crash, which occasionally happens. I'm not going to admit that I crashed, even though I ended up on the ground in a bush because the thing hit a rock and I went flying over the handlebars. I was probably going too fast. But my friend's laughing and I was fine. I just went up in the air and flew out. He's laughing. He's in tears. I'm like, look, just check me out. I took my shirt off, a couple of ticks, so we pulled them off and everything. But yeah, these bugs are everywhere. They're going to take over the world at some point because there's too many of them.
More than us, more than them than us.
Yeah. Got to be careful. Protect your home environment. Check your dogs out. Dogs will bring ticks when they go out. It's a lot of work to be very healthy, and maybe it should be. Eat right, exercise, organic foods, get your blood tested for vitamins, get your vitamins on board. More and more, now so more than ever before, we have to be really vigilant and diligent in what we do to keep ourselves as healthy as humanly possible. Super, super important. You can't be healthy without exercise. You can't be healthy without correcting your vitamins or your hormones. Can't be healthy without looking at heavy metals and some of these damaging things and get them out of your body.
No questions, just a comment that says "kill them all." And I'd imagine this is regarding ticks.
Yes, I imagine so. I hope we haven't hit into a terrorist cell that's talking about something beyond the ticks. Yeah, so, I mean, the more people learn, the better, because then you have the ability to make a decision, a good, educated decision as to what you want to do. And then, as you do that, you want to be able to document your improvement, watch and see, and show that what you've done has created that result. Super, super important.
Yeah, and there seems to be, there's clearly, with the research and how doctors, the doctor that you're going to have on, it's going to be for me, it's going to be so cool to hear him because, we all know that the government didn't necessarily want all of these studies to come out.
Initially, there was a lot of pushback against
almost as if they maybe
great work that he was doing. But if he wants to tell that story, then I'll let him tell that story. But yeah, it's just it seems like there are things that get in the way of, trying to be super healthy and trying to do the right thing. And certain states don't allow testing to be done. There really are good tests. There's a test that had been around for years, and almost every state in the country allows it, looking for early signs of cancer, but New York doesn't. And there are new tests created by new, very diligent, great labs that are coming out that you think, oh my God, why wouldn't we want to do that? It's not something that happens.
Yeah, and you were even making phone calls before we went on air to say, hey, is this still the case?
Looking for more information. So I did find, to that note, and thank you for reminding me, there's a genetics lab called TellMeGen, TellMegen.com. Just found that does inexpensive genetic testing. Now, the purpose, in my mind, for genetic testing is to see, yes, whether or not you may have a risk for a certain genetic disorder. Certain nationalities and backgrounds have more risk for certain things. Good to know. There are genetic tests for medications. And these genetic tests can tell you if you should never take a medication because your genetic ability to metabolize something would be damaging or a risk for you. You'd want to know that. Who wouldn't? Especially people, taking 5, 10, 15 meds. You also want to know what meds interact with each other that you might be taking that you shouldn't take, and you may change the meds. Medications that would never work on you or medications that would work and be safe. That's great information. Years ago, probably 2017, 18, 19, big companies were creating these kits, and they charged a lot of money for it, because that's what happens when a new test comes out. They charged a lot of money to make their investment back, and the insurance companies, including Medicare, were paying for those tests. I didn't know initially, but I think that there were labs that were charging a lot of money for that, probably $5,000 a test, which could be life-saving for some people, but I understand, the insurance companies didn't want to pay for it. So they stopped doing that. We got a lot of great information on all the patients that we did it on. We did it on thousands of patients. I thought it was a great test. Still think it's a great test. But since then, you can't get it done. So I've been looking, and this morning before the show, I come in, I strategize with Frankie and Sabrina. We talk about all sorts of cool things, and I was looking to find a company that does this test. And this test from this company, which we're going to use a great deal of in the office, I think is $179 for this test. Genius. So I think it's important to do. TellMeGen.com. And there's some new additional stool testing looking at microbiome, etc. And we're going back to Genova Diagnostics because they've done this. The odd circumstance, and years ago, for many years, we used to use Great Smoky's diagnostic labs for the comprehensive stool test. They'd send us kits, give it to the patient, get it done, they'd send it out, and get a great report. But then whoever in New York decided that you're not allowed to do that test in New York, but every other state is allowed to do it, couldn't do it anymore. Now they have a whole new mechanism of doing tests that are approved by New York. So this is relatively recent, now we're going to be able to do these things again. So it's great to know and to understand because, we can help a ton of people out by doing these tests. So, sooner or later, some things kind of cycle back around and we can, utilize those to our advantage. But it's just constant vigilance of looking and learning and trying and reading and et cetera. So
we got some angry New Yorkers in the chat, and they say, "Of course, it's my state."
Yeah, that's not the that's the tip of the iceberg that I can't really talk about fully. Yeah, someday we'll get into some of that where I think, and I don't know who makes the decisions. Hopefully, the newer administration, and if I can reach and talk to somebody, we'll try to get some better policies, put together. But we're trying that from a variety of different angles. To do some of these tests make, a world of difference in patients' health. And it's all about learning, and it's not about guessing. It's just show your body what it's doing. Let's figure this out, correct it, and your body does extremely well. So super, super important to stay aware, read, learn, look, get some knowledge. We'll have a few more minutes, I guess. 888-420-9272 if you'd like to call in or just text Frankie. Let's chat.
They love our little back and forth.
Yeah, no, it's good. This is the way it should be. I mean, I wish I could have done this years ago. And I keep saying the difference between what I did on radio, and I had a really big radio show. So I was on radio for 35 years, started on WGBB, went to WEVD, which was gigantic. And at the time I did that, it took my East Meadow practice and my Manhattan practice on 53rd and 5th. We were booked 4 months in advance. You couldn't get an appointment. So we had a cancellation list. But the cost of radio was very significant. And by the time we got to where COVID was and that disrupted everything, I wish I would have started the podcast, years sooner. Not as though there was a lot of podcast stuff going on. You were probably too young 20 years ago. You didn't have all the knowledge about the equipments and the
perfect timing.
So yes, it is perfect timing. So to be able to talk to people, for them to be able to see me, watch and follow and look at diagrams and things is something that obviously could never do on the radio. And the connectivity with people on the radio was just very, very bare. Of course, we had a lot of patients coming into the office. There were times we'd see 100 to 200 new patients a week between the two offices, and it was phenomenal. Now, the beauty is that people will comment, they'll like, they'll subscribe. We can thank them online. They ask questions online. There's more connection. People will then email us at the website. So it's more integrative. And I appreciate that. I respect that because I like that. Everything I do every day that I'm at work is connection and talking with people and working and fixing and learning. And, it's the most interesting thing for me to do. So that's why I love the connectivity here. So as we try to bring the podcast to more venues and get it out, maybe across the country, interview more doctors, more people, just want it to be as educational as humanly possible.
And all I'm just going to say is, 10-year-old, 11-year-old me, I think I'd figure it out 20 years ago.
You have the skills. Yeah, you have the skills. I should have called you back then. Okay, friends, thank you for listening in. Tell your friends, your family, send the information around, like and share, etc. Subscribe, and we'll be back on Friday at 12:30 with some more cool stuff. I'll see if I can get a couple more interviews set up, and then Saturday again at 2:30. Thank you for listening. God bless.